So this is case number 2. It was a 12 centimeter liver tumor that was developed in a 25-year-old woman who consulted for abdominal discomfort, and the lesion was resected. So here is the slide from the surgical resection. You have here the adjacent non-tumor liver, and here the tumor. We'll just have a quick look at the adjacent liver. So there were nothing really remarkable besides small inflammatory infiltrate in some portal tracts here again, but it seemed pretty normal. But now let's go and take a look at the liver tumor. So you can see that the tumor is composed of vascular spaces that are filled with red blood cells, and there are some small fibrous walls, and here you have the endothelial cells that completely lack atypia. And when you go to other sections, other areas, you have these fibrotic areas that are likely due to recent thrombi. And so this case was an hemangioma. And usually hemangioma diagnosis is done at imaging. There is no need for a biopsy. There is also no need for resection unless the lesion is symptomatic or there's a great risk of bleeding. But when the lesion undergo a thrombosis, it may give an atypical appearance at imaging, and a biopsy may be performed. So when you have a biopsy with fibrosis and also some vessels, always think maybe it can be a sclerosed hemangioma, and these fibrotic areas are responsible for this atypical pattern at imaging. So that was really a textbook hemangioma of the liver. It's benign, it's really frequent in the general population, and radiologists see them really often, but we don't, because there is no need for a biopsy most often and no need for surgical resection.